So I'm Zaid Shalchi, and today we're going to be talking about intravitreal injection treatment. You're probably watching this video because you've seen a doctor and you've been recommended intravitreal injection treatment. So what is this treatment? So intravitreal injection is an injection given directly into the eye. This is typically done to treat a condition affecting the retina. It's usually done as a course of treatment over several months or years. So how are these injections performed? No one likes the idea of having an intravitreal injection, but most patients tolerate it very well, and they say, "I'm not really sure what all the fuss was about." The procedure is usually done in a designated clean room in the outpatient clinic, so you don't go to theatre for it. Anesthetic and antiseptic drops are given to the eye, and then you'll be asked to lay down on a trolley. A drape is placed over the eye, and a clip is used to keep the eye open. A very fine needle is then used to inject the drug directly into the white of the eye, but you will never see the needle itself. The procedure is usually over in a few seconds, after which your vision will be checked and you can go home. So why is the intravitreal injection treatment done? So most intravitreal injections are given to treat diseases of the retina, such as age-related macular degeneration, diabetic retinopathy, and retinal vein occlusion. Intravitreal injections can also be done for inflammatory eye disease, otherwise known as uveitis. So what are the different types of intravitreal injections out there? Most intravitreal injections contain proteins or antibodies that target a molecule called vascular endothelial growth factor, or VEGF. These injections are numerous, there are many on the market, but the most common of them are called Eylea, otherwise known as aflibercept, that's the generic name, or Vabysmo, faricimab. There are many others on the market now, including biosimilar products that are cheaper, but equally effective. Another common intravitreal injection is called Ozurdex. This is a steroid implant that's used to treat some retinal diseases, as well as uveitis. So let's talk about the risks of intravitreal injection treatment. The main risk is a 1 in 1,000 risk of a condition called endophthalmitis, which is a serious eye infection that needs urgent treatment and can permanently damage the vision. This needs to be balanced against the risks of having no treatment for sight-threatening retinal disease or inflammatory eye disease. So it's a fine balance. It is common for patients who are having intravitreal injection treatment to notice that the eye is scratchy or watery after the injection, although this is usually something that settles within 24 to 48 hours. And finally, are there any alternatives to intravitreal injection? Now, in some patients, there may be alternatives such as laser for the treatment of some forms of diabetic retinopathy or retinal vein occlusion, although laser is typically less effective than an intravitreal injection. Some patients with inflammatory eye diseases can be treated with drops, although this again is usually less effective than intravitreal injection treatment, which generally will be used if patients fail to improve with drops alone. I hope this is helpful.